Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center, and this morning we're going to be discussing case number 01525. This was a 4-year-old boxer mix, I believe. I'm sorry, but it's the main symptom was limping on the back right leg, and so when we're looking at what causes symptoms, that's a genetic expression. And then we have environmental influences that put stagnation or pain or stiffness on the body. So if we run into a wall, for example, the wall being solid is going to exert its force back on us. So environment is really the forces that are put on the body, and then the body responds in kind to a genetic expression. So if we are stepping into the yard, for example, and that environment creates stagnation, pain, or stiffness, then the genetic expression is limping on the back rear leg. But the question is, why are we susceptible to the environment? Well, we have imbalance present, so that's where the internal factors come in. So the IHT analysis show that we have 3 weaknesses and 2 stresses. So this combination makes the body more susceptible to experience the influence of the environment that causes pain and stagnation and stiffness and leads to the genetic expression of limping on the back rear leg. So the question, what does all this mean? Well, weak nervous system, so weak nerve communication can allow the body to be more susceptible to environmental influences that can cause limping. The SI3 is the lower back, lower small intestine. So that has the lumbar area included, so all the lower back, so low lumbar muscles and the back leg. That weakness can cause more susceptibility to pain and stagnation and then limping. Certainly the kidneys, weak kidney is cartilage and bone. Certainly get rid of toxins in the body can have an influence. On the stress side, we have the heart, and the heart has for circulation. And then also LY3 is the lymphatic code for the sinus. And so stress sinus tract can also lead to susceptibility. So this here, the imbalance, makes the body more susceptible to environmental influences that can express the genetic symptom. And that's the cascade. So we got to rebalance this. And then we'll get into sensitivities. But how we rebalance is we use hemp oil infusion. And that's 5 drops for 3 months. And that rebalances these. In the meantime, we're over here managing the limping. And we can use various things, but if it's not affecting eating, drinking, sleeping, urination, defecation, or activity is the way they express themselves that allows you to recognize them as your dog. And if they're doing those things and you say, well, that's just like him, then you know that the normal activity is present. But if limping interrupts any of these, then we have to step in with more conventional therapy. So that's where carprofen comes in, for example. Ficox chews. Those are things that are going to help to eliminate dysfunction and restore these back to normal. If we're not affected here, then we want to use something that's natural as possible. So a product like Bodysore, which is a Chinese herbal that actually supports the body versus controls the body. Much like if you see somebody that has a heavy load with a wheelbarrow and they're struggling, you could, if you're going to control it, you would say, well, stop moving the wheelbarrow. If you're going to support, you would add some extra support and allow the strength to continue. So that would be considered supportive. So that's where the Chinese herbs are more supportive here. But if we have to control things and stop that pain and inflammation because it's interrupting life, then we want to be able to do that. The hemp oil is going to condition. The question is, what's also contributing in the environment? And so there was a list of sensitivities. Group plus environment, household chemicals. So any household chemical, and that's going to be a seasonal influence, whether we're on the inside of the house or the outside. Outside of the house is going to be when they're spraying for insects, for example. Group and environment, and then epidermals goes into fabrics. Cotton was one that came up, so cotton sensitivity, so anything cotton in the house. Genetics plus environment, inhalants, we had 2 miscellaneous, and cacti, which are going to be dusts, including house dust. The cacti are going to be more broadleaf plants, so like the Dieffenbachia, for example, these are more household plants. And then we come back to group, food, and additives. So anything with additives, anything processed, food coloring, etc., we got to be careful of. And then in the food group was nuts, so anything that has nuts, peanuts, walnuts, almonds, anything that could contain nuts that you might share with them. A lot of times peanut butter is used to give medications. We have to be careful of that because this patient is sensitive to it. Sensitivity weakens the genome, allows them to express more negative symptoms. It also contributes to the pattern. It also contributes to imbalance. These we can't change because it's part of the genetic genome for this patient. So we can't change the sensitivities, but we can be aware of those things that could cause potential weakness and stress. So always rebalancing the body puts it in a better position to handle the environment. So running across the yard, jumping for a ball, for example, those kind of things can be done more easily. If you have questions, 847-541-4005 is our number. Take your base point reading and your sensitivity list, go through that, watch the video, and then answer questions that you have in terms of what does this all mean. And then second of all is the therapy, using the hemp oil at 5 drops a day, using Body Sore for pain and stiffness on a more natural realm, and then using carprofen or Ficox if needed over here in terms of if it's affecting quality of life. So for the next 3 months, we're going to be conditioning, we're going to be supporting, we're going to be controlling any negative symptoms over here. So if you have questions, there again, our number. You can also use our email, groveanimalhospital@gmail.com for after-hour questions as well. We're going to get this all put together for you. Some owners already have their hemp oil, so if that's the case, fantastic. If you're not using it already or haven't picked it up, then we'll make sure we get that available to you. The Body Sore we do carry as prescription herbs, so we'll get that for you as well. And we're going to give you a call and confirm it. Make sure you've got the link to the video, and then discuss the pickup time for the medications and rechecks, etc. Thanks so much.